What's up, guys? Welcome to the podcast where we can listen to trans and gender non-binary voices telling us their story in their voice, reminding us that each of us is not alone.
Hey everyone, welcome to another episode of Not Alone. And I have with us the one, the only Jerrica Kirkley. When we last spoke, we kept talking a lot about this idea that you were discovering who you were. You were in residency, still discovering that process. Could you talk a little bit about self-discovery through med school, through residency? What was that emotion like? What was that feeling like?
Yeah, well, I'll say through a lot of medical school and in residency, there was probably minimal self-discovery because my brain was so preoccupied with trying to learn, stay above water, and just survive medical school and residency. It's, and I think that survive is probably a key word there for a lot of people. You go into survival mode and you're just trying to make it out the other side, and it's a whole lot of information and stress to manage. So when I look back in retrospect, I don't think I had a whole lot of time for processing or space for it during that time. And I think that's why it happened later, where I really was able to dig in and start to process things. And of course, start to acknowledge a lot of this to myself that I had not before after completing residency. But during that time, I'll say in residency was probably where, at least on a subconscious level, it started to happen a lot more because I was much more intimate with the work itself and working with the trans community and helped build out an LGBTQ plus curriculum for the residency, for the actual physician residents and the faculty physicians of that program in Colorado. And a big part of that was building out a protocol based on the guidelines for care that exist and have existed for a long time, specifically for gender affirming hormone therapy, which was not done routinely at that practice before I got there. I had an awesome mentor who wanted to build out this curriculum and really expand gender affirming care at that program, and put this binder in what we call the residency room or the precepting room of that clinic, and people started to use it. And that was part of that light bulb moment of understanding, one, there's a huge need for this, and two, if you provide some training and some competency, one, providers are going to feel comfortable to do it, and two, patients are going to come to your clinic because they're going to hear about it and they're going to tell other people. And so I was doing that work on a regular basis. I was deep into it. I was researching it. I was putting together care protocols for our residents and physicians, and answering questions and continuing to train folks on that. And so, and of course, seeing patients, right? And hearing those stories firsthand is so meaningful, so impactful. So again, even at that time where I had not fully acknowledged this to myself, hadn't come to that realization, I think a lot of the groundwork was being laid, and for me to be able to do that later.
So I think that's an important point to note, right? For some individuals, this is not a continuous thought process. Am I trans is not a question you're continuously answering. So it's important to recognize that your journey isn't less valid just because other life priorities took priority. In your care, as you were developing this binder, what were things that sort of jumped out at you where you were like, wait a second? It's one of those things where I remember reading about abnormal psych, and reading about, like, when I went to pharmacy school, I landed up reading about disease states and pharmacotherapeutics and the like. And I remember going, I have every single one of these diseases. And that's one of the common things. So one of the questions that I have to ask is, as you were looking at this and you were reading and creating this binder, how did you kind of go, wait a second, am I seeing myself in this? So could you talk a little bit about that piece?
Yeah. As I'm like developing those guidelines, putting together that binder, delivering the care, at that time, I don't know if there was like a specific moment where I was like, oh, like, this is me. That happened certainly in a big way later. I will say there was this very specific moment when I couldn't totally explain why I felt this, and it's a little, of course, not like fully comprehensive or representative of all of me. But there was this time where I was like, I just feel like a lesbian, right? Like, and it was this sort of, without, again, as much context and deeper analysis and realization, it was just like this feeling that I had. And of course that can mean a lot of different things for different people, right? And identify as lesbian, queer, pansexual. There's a lot to it, but it was just like this notion of like, wow, like, I think that was that first point where I wasn't fully, I think, realizing what I was saying, but I was like, oh, there's definitely some othering here. And I just like feel different, and I don't feel like what I've been told I am like all this time. And that was like a really specific moment that I remember feeling that way. And but it was like the rest of it, that kind of came, and I was like, oh, I don't know what that means, and kind of pushed it aside, until of course I addressed it in a much much bigger and more meaningful and truthful way later on. But that was a particular thought that kind of came into my head, and I didn't really know how to explain it at the time.
Which is kind of interesting, right? You didn't go, I'm attracted to women, because you're a guy that fits into the heteronormative world. To go, I'm attracted to women, was I feel like a lesbian, which inherently is acknowledging that, as you just put it, I'm different in some way.
Mm-hmm. Mm-hmm.
And that process, I think it's fascinating. And have you heard that term? I feel, or it's not a term, but phrase, I feel like a lesbian, mentioned by more trans people as you speak to them?
That's a good question. I don't think I've heard necessarily that particular phrase from somebody else, although I have talked in different arenas, talking to a lot of trans people and talking about gender affirming care and my journey within that. And I've mentioned that, and I've definitely seen some head nods, right? And some like, oh yes, like I, whether it's the exact same thing or not, but have had a similar feeling. And so I've definitely seen some acknowledgement and probably relating to that feeling from other trans folks. Yeah.
So I want to come back to the term you used, gender affirming care. As I was starting to prep for today's meeting and I was working through the previous interview that we did, you used that term. And to a person with a hammer, everything looks like a nail. So when I looked at it, I went, oh, this must be about the medications. And then someone, my copywriter who was working with me went, medications? No. This is about the overall comprehensive healthcare. And I kind of had to go, wait, which one is it? What does gender affirming care mean?
Good question. Gender affirming care at its core is really any healthcare delivered to a patient that takes into account the lived experiences of the trans community, and lets that inform the care that's being delivered. And so that could be primary care, preventative health visits, any chronic care within that, diabetes, depression, anxiety, can be things like gender affirming hormone therapy, which of course is more specific to the trans experience, can be things like gender affirming surgery, again, more specific to the trans experience. Also, of course, any surgery, any specialty care. So really any healthcare that takes into account the lived experience of trans people. And when I say that, we're talking a lot about things like cultural competency, cultural empathy. And so everything from making sure we're addressing folks correctly. We're not making assumptions about their gender, about their name, about their pronouns. And we're doing that in action, but we're also making sure our systems, to the best that we can, are accounting for that as well. So, for example, our electronic medical records that we're using, whether it be in a clinic, a hospital, a pharmacy, health insurance company, or any other platform that patients are having to be entered into, is addressing them appropriately, both to the teams taking care of them and reflecting that back to the patient. And so that's just one example of that. But of course, making sure everything that we're doing is thinking about that, and whether that is with the systems we use, the counseling we're providing, the medical care we're providing, that we're really taking into account that nuanced experience.
Thank you, because when that was brought to my attention, I very much was thinking about the trans-specific issues of surgery or medications, and what you were taught, what the term means, and this is why your binder is so important. It's talking about that larger cultural competency, the larger healthcare, the larger acknowledgement of your needs may be different, and we need to address those needs in a way that is comprehensive and considers you as a whole person. You are not just your experience as a trans person. You are a individual who happens to be trans, but all your healthcare needs need to reflect and consider that part of you as you continue. One of the other things that sort of jumped out at me as we were talking about your experience was this idea of, I feel like a lesbian. Because to me, this is where you get into a lot of the arguments, right? People who are trans exclusionary radical feminists, they take the position that, well, how do you know what a lesbian feels like? How do you know that there is a experience that is common to lesbians? And how do you address that question of, I feel like a lesbian. Well, how do you know what a lesbian feels like? How do you address that concern that gets raised?
Gotcha. Yeah, first and foremost, I would say that any identity, whether it be a sexuality, whether it be a gender identity, is really left up to that individual to decide what that means for them. That's it. That's it. Because it doesn't matter what I think it is. Doesn't matter what you think that is. Doesn't matter what anybody else thinks that is. Because it's ultimately what's most important is how that feels for that individual. And at the same time, I think, and to make sure that we're respecting others, right? And that we're not somehow leveraging our identity in a way that belittles somebody else or invalidates somebody else. Right? And when we talk about trans exclusion, trans exclusionary radical feminists, any person who might identify as one thing or within a group, and then holds that over somebody else to say, like, no, you're not actually are in our group. They just can't say that, because now they might say that this doesn't align with how I feel. And that's fine. That's your right. But when we start using that to invalidate others, I think that's when it becomes problematic. And so at the end of the day, there's a lot of terms out there. There's a lot of words out there and all of our languages that we use. And we have to understand how that aligns with who we are. And there's many other, again, terms and identities that I do identify with beyond that one. But when I think about that, it could be different, certainly, than how somebody else thinks about it.
Thank you. So what I'm hearing you say, and please correct me if I'm wrong, I'm not trying to put words in your mouth. What I'm hearing you say is you're not tying it to invalidating their position. You're tying it to the respect of the individual themselves, and tied to, this is how the individual identifies, and it doesn't cost you anything to acknowledge them the way they want to be acknowledged. So why argue over something that really you don't lose anything from? Is that a fair?
Yeah, I think that's fair. Right. It's like,
okay.
The fact that somebody else might identify that way, just as I'm saying, like, well, it's not fair to invalidate somebody else, like them identifying that way doesn't invalidate you, because each of you experience it differently. And so,
right. Here's a question that I hadn't, well, I'm planning to ask any of the questions I'm asking right now, but it's still kind of interesting to me, especially because you come from a clinical background, which I think adds a unique twist to a lot of the other individuals I've asked questions to. We've talked about trans care, but that usually suggests the idea of moving, depending on whether you believe in the gender spectrum or you believe in the gender binary, moving from the masculine towards the more feminine, if you will, for lack of a better term. In this specific context, assuming masculine and feminine, obviously. There are individuals who identify as non-binary. Now, when you talk about non-binary individuals, how did your file, because I'm now fascinated by your folder or file, whatever you call that, how did your file sort of address taking care of those individuals? Was that considered, for example?
Absolutely. Yeah. And it said what I always say and what I still say is that we, as medical providers, should never be treating somebody based on their gender identity, full stop, right? We should be providing care that is in alignment with their goals. And that goal might be to take testosterone to masculinize their body or change their body in such a way that aligns with who they are. That goal might be to take estrogen or other medications to change their body in a way that aligns with who they are, right? And so at the end of the day, it doesn't matter if you, let's just say, might fall on the feminine spectrum, identify as a trans woman, as feminine, as trans femme, whatever that title or label that feels best for you is great. And that's important. And of course, we want to hold that and use that and reflect it back to you, to respect you. But that doesn't necessarily mean that, okay, you're taking a high, like a certain dose of estrogen or taking a T blocker along with that. That's going to be curated based on your individual goals. And of course, making sure that we're doing this in a healthy way.
And I want to move on from this period of your life because I really thought we'd be talking about the other periods of your life today, but this is so interesting because you are, in many ways, you broke ground by writing this folder, which I assume is still in existence. I assume it's still being used in so many different ways. How can trans individuals who want care find people who understand and address their needs? Like, do you wrote this initial folder, but you said you based it off of research being done by others. Are you aware of people, whether in the U.S., outside the U.S., within the U.S., in different places? How can a individual who either is trans, is wondering if they are trans, find care that is appropriate for them?
Well, that's largely going to depend on where they are, right? Like you said, around the world, conditions can be quite variable. And in terms of folks' access to healthcare, just the environment around them, the laws that exist in different countries, danger and risk that might be there in a real way that might not be present in other areas. So certainly largely depends on where you're located. I can speak a whole lot better for the US since that's obviously where I live and have lived all my life. Now I've traveled around and seen other countries, have a sense for what's out there. But for a lot of people, it starts by oftentimes talking to another trans person. And I'll also say that it is because of the isolation that exists due to stigma and bias, certainly here in the US and around the world. Can be common that a lot of trans people don't actually know another trans person knowingly, right? Even in the world of pretty immense connectivity with the internet, that can be hard. But I will say that online is where a lot of people have gone, right? For many years, many trans people have lived in online communities because we haven't had safe spaces to live in and to be in the brick and mortar setting. So that has been going on for a long time. Certainly before was things like online forums, and back when the internet first came out, and now social media has taken that up in a big way. So I'd probably say that's now, again, depending on the context where somebody is, what their access to that form of technology is. But yeah, that's probably one of the most common ways where people find out about access to care, and just asking people on these sites. And if they're lucky enough to ask people in person, but word of mouth, effectively is how it's been for a long time. I think we're hoping to change that paradigm, right? In terms of the work we're doing at Plume and hopefully having these really, more formalized and vetted resource centers and content centers where everybody can access that information, know how to get to it quite easily. But yeah, for a long time, it's by word of mouth, talking to people, hearing where people have gone, hearing the recommendations.
I don't mean to belabor this, but it happens to work out because you are a leading world authority on the issue of trans care, if you will. If a trans individual calls Plume, what kind of resources do they access? Is it more about we will address your medical needs? Is it more about, let's first discuss who you are, what you need, let's talk about it? Is a holistic treatment? Like, where does Plume and fall into the larger spectrum of things, because it sounds like if you are in more rural parts, for lack of a better term, or more conservative areas in the US, access to care may be more difficult anyways. And add on to that cultural and religious concerns that access may be even more hampered. So how does Plume as an organization, and again, I'm not sort of making you responsible for speaking for Plume right now, that's not the goal, but just speaking to it generally, how does that sort of come together? How do you help individuals who are questioning or concerned or all that good stuff?
Yeah. Well, a few different ways. We do have a pretty big following on our email listserv, on our social media channels, and that can be a place where they can get content. They can get information to help answer a lot of those questions they're having in written format. We've done things like webinars in the past. We'll invite the community to come and attend a session where we're maybe talking about a topic related to, of course, anything in the realm of being trans. And a lot of people will ask questions on social media. We're not actually obviously giving medical advice if they have not seen a licensed clinician. But we do have different places where those discussions can take place. And if folks are in that questioning phase, right, and just trying to find more information, we have blogs. We have a lot of awesome blog content accessible to anybody in the public. You can go and read that right now. We've done like some Ask Me Anything sessions as well. Like I've been doing those, where folks can tune in and listen and ask questions. So a number of different ways pre-clinical visit. Now, if you become a patient of Plume, there's definitely various ways to get your needs met, whether that is something like gender affirming hormone therapy, obtaining a letter for surgery, which hopefully will be something that we won't have to do anymore now that the new WPATH guidelines have come out. And then things like attending one of our peer support groups. We have virtual peer support groups, which have been really helpful for folks, and expanding into broader primary care services. So a number of different things you can engage in once you're a patient with us. But we do try to create those spaces where for folks who do have questions can start to get those answered, or at least move them in a direction that feels good.
So let's continue down your life journey, and thank you for sort of giving that information to individuals who are going, well, what does this mean for me? But let's continue down this journey. We've now, you created the document, you've created a company now, but we jumped over an entire phase of your life, which is you worked for a federally qualified healthcare program.
Health center, technically.
Health
federally
center.
Qualified health center, FQHC.
Health center. I knew it was a C. I couldn't figure out how to put that in, but there you go. Health center. And you developed a program there. Mm-hmm. Could you talk a little bit, and you were there, I believe, since 2015, going on, I believe, 5 years or so. Mm-hmm. And there was a point where you were transitioning out of the centers, and you were transitioning into Plume, while similarly transitioning out of identifying as male and transitioning into who you are today. So could you talk a little bit about your journey, your awakening in that process? Obviously, the awakening has been a process this entire time, but how did sort of, what was the fire that lit, what was the match that lit the fire, if you will?
For which part?
I don't know. Are they connected?
Definitely connected. Yeah, we've talked about this a little bit before, but I think the match that lit the fire. Wow, on the work side, just in thinking about starting Plume, versus where I was working before. As you said, when I was working at this FQHC, I built out a gender affirming care program there. Was taking care of a lot of trans folks, teaching providers on how to provide that care across 13 clinics, and really just always looking at ways that I could help increase access to care for the trans community. And that was one way I was doing that. I was, doing some volunteer work with a free clinic that was trying to provide gender affirming care there as well. And I'd say the moment for Plume really was February of 2019. And I was talking with my co-founder, Matthew, and we were best friends since medical school. We talked all the time. You know, we were attached at the hip in medical school, basically, or the reason that we both got through it from the very first year. But we both went to different places for residency. I went to Colorado. He went to San Francisco. But we would talk all the time, and I think we were both feeling a lot of burnout in some ways in terms of dealing with the healthcare system, seeing that it was not doing a really good job attending to the needs of both patients and healthcare teams, and really all patients. And now I was seeing that in an amplified way in the trans community, of course. He was seeing it and with a lot of different communities in the ER, and seeing the troubles with that system. But had started to work in the digital health environment. So with some of these newer telehealth companies that were coming up, around that time, 2015 to 2019, all pre-pandemic, and providing kind of basic urgent care services online, right? But we were talking one day, and I was actually on vacation visiting my sister who lives in St. Croix. She clearly made some very wise life decisions that I'm envious of. But had the privilege to be visiting her, was standing there near the beach, and we had our little call scheduled, and so we were chatting, and he was telling me about his experience working for one of these companies, and I was telling him about, I was like, hey, like I'm feeling really burned out, but I love the gender affirming care work. I know it's what I want to do with my career. Trying to figure out a way to keep doing that, but also, of course, stay fulfilled, with the practice of medicine broadly, and find a place where that feels good. And he was just like, well, what if you just did this, with one of these companies, just call them and say, hey, I want to be your gender affirming care provider, sign me up. And so we effectively kind of tried to do that. Now they weren't really interested at the time. And so we said, well, heck, let's just figure out a way to do this. So that's where it all started, and then of course led to a pilot later that year. We did a bunch of research, we ended up getting funding, and then, turned it into what it is now. But that was like the aha moment, that trigger moment for Plume specifically, which of course was a build up and of both of our respective careers and personal lives. But one thing that happened before that, which was really interesting, is I was trying to start actually at an FQHC, a federally qualified health center dedicated to the trans community in Denver. And the idea is this would be kind of the FQHC hub for the trans community in the Mountain West region. And really wanted to build out a comprehensive trans care clinic. And funnily enough, doing that now in a different way. But I ran into a lot of red tape with restrictions around where you can start FQHCs if there's other FQHCs present, even though those at the time were not really doing a lot of this care and certainly weren't focusing on this community exclusively. And that was frustrating. And so I had, even to the point of like having some potential business partners, starting to get a grant off the ground and then being told, oh, no, you can't do this. And so that was like a pivotal moment where I was feeling really defeated, dissatisfied with the system, especially that system that I worked in so long. And I know that is so important and valuable for many people. But I saw it not, again, meeting the needs of the community, of my community in a way that I thought it could. And so pushed me over the edge to say, hey, well, let's try this other avenue and see if that works.
So at any point, did it feel personal? Did it feel like it was not just about starting a company? It was about seeing your experience reflected in care. I don't know how to phrase that better, but does that question make sense?
It does make sense. It's a great question. And I don't know if it's something that I necessarily was consciously thinking about. And even, at the point where I had, of course, acknowledged this to myself, my true authentic identity. I kind of saw it as those running in parallel, right? Where it's like, that's my personal journey. This is my professional journey. Of course, there's a relation there. And it's just so powerful to do this work, and it's beautiful work, and I would love to do it, regardless of who I am. But that did end up aligning. And so, yeah, I mean, if was it that pushed me into, I mean, I think there's an interplay there for sure. To what degree or percentage I could say was like one way or the other, hard to know. But it's nice. I mean, it is nice when you can have that personal experience, and you of course know that, hey, like if I'm walking through this healthcare system, I want it to be good for me, and I want it to be good for everybody who might have some element or of what I'm going through, and so that, yeah, I'd say that's a motivator for sure. But of course, just seeing the massive unmet need was probably the bigger one in terms of thinking about starting Plume and really trying to make a more widely accessible care form.
Now, it's interesting. You talked about your co-founder who is a very close friend of yours through med school. When did you come out to him?
So I came out to him. This would have been short. I guess it was shortly after that conversation we had about starting Plume, but in 2019, and I actually went out to see him. I was going to a healthcare conference. Actually, it was a trans healthcare conference, and we were talking, obviously, very early days, but kind of, in that exciting brainstorming phase of like, oh, wow, this is all the things this could be. This is what we're going to do. This is how we're going to try to get this off the ground. And at the time, because again, it's an evolutionary process. And I knew, like, hey, I'm not cisgender. Like, this is very clear to me. And, wasn't totally sure where I was going to land on that spectrum. And cautious for many reasons personally about how I was expressing that to the outside world. And so at the time, for me, that was like, okay, I am non-binary, or like I'm not cisgender. So that was the first time, that I told him, and he was like one of the first people that I came out to. And then of course at that point he was along with me on this journey, lockstep, and so as that evolved, he was there to hear of that evolution, watch it, and of course support me all along. But yeah, that was the first time that I had mentioned that to him.
I guess the reason I asked that question is we've talked about your many successes in getting to Plume, making it what it is today. We've talked a lot about your many successes discovering who you are through that process. What we haven't discussed, the difficulties in sharing who you are with others. And you obviously had a very successful time doing it with your co-founder. Is it Matt? I'm sorry, I keep...
Yeah, Matthew. Yeah.
Okay, Matt. Okay. You were very successful sharing it with Matthew, but was your family as equally comfortable hearing about it? And how did your other friends react? What was that experience like? Because in the end, the goal of this podcast, this interview, is, did you ever feel alone, or were you always supported through that? And is this something individuals should be as worried about as they often are?
Yeah, well, the last one I'll say is going to vary, and I certainly can't speak to that for other people. But having gone through it myself and seen a lot of people go through this as well, it's also going to vary based on who it is. And many people can have wonderful experiences, and there can be some really hard experiences, and even sometimes dangerous, right? So I'll only speak about mine specifically, and even within that, there is some variability. I'd say I very fortunately have had a lot of friends, and I think probably like formed a lot of bonds and connections with people who tend to maybe have a bit more expansive view of the world. So when I told them, it wasn't so hard for them to even conceptualize it, to support me. And so I did have a lot of close friends who I told, who were extremely supportive, and that was amazing. Family, definitely various things there. Some were more supportive, some were less supportive, and navigating those issues to this day. I'd say on the, more direct family side, led to me going through a divorce, and, that's obviously a really hard thing. And that comes up a lot for folks going through this, ending of relationships in many formats, but in particular, romantic relationships or partnerships. And, fortunately have been able to navigate that fairly well, and, feeling like I'm on good terms. But yeah, at the beginning that was really hard, and it did result in the loss of relationships with other family members, and even with other friends. And so I've kind of seen all sides of it. Fortunately, nothing really bad or horrible. And so I feel fortunate for that. But yeah, it I think certainly makes you reflect on that it is important to make sure you are surrounding yourself with people who do love and support you, and really makes that phrase we hear a lot, chosen family, come to the front of mind. So yeah.
And are you a superhero movie we did discuss this. You actually are a superhero movie person.
Yeah, I like them. Okay. Yeah.
Okay, fair enough. Okay. There's a scene from the X-Men, going back several years. Did I reference this at all? Because I referenced it in another conversation. Okay. So there's a scene from the X-Men. I think it was the Zack Snyder X-Men, I think, but I could be wrong. But there's a scene where they were talking about mutants, and they were talking about they were comparing it to the LGBTQ experience. And in it, the parent goes to one of the mutants and goes, "Have you tried not being a mutant?" And the response was, "This is who I am. It's not something I get to control. It's not something I get to say no to. It's just who I am." When you talked about this journey of coming out to different people, especially family, and you talked about the difference between chosen family and what I'm calling blood family, but I don't know what the other term for it would be. But is that right? Blood, or is it born with, or is there a term?
I think blood family works. I've heard that before.
Okay. Did you have to struggle with people asking that question? Have you tried not being trans? Was there a response where you went, "Yeah, that's not an option"?
I'm trying to think if it probably came up in different ways from some people, I'm sure. I'm certain in some way or another that was kind of brought up. Yep.
And did that, when it got raised, did you feel? I imagine that question makes you introspective, and it makes you think more about, well, have I? Can I? Even if you've thought about that question 1,000 times, you think about it the 1,001st time again. Did it solidify in you what you already knew? In that you kind of went, have I tried? Yes. This is not an option. This is who I am. So essentially having a counter, a reaction that is the opposite of what the person expected, if you will, for lack of a better term. Does that question make sense?
It does make sense. I think it probably does make you reflect a bit more on that and affirm it more, to your point, right? Where it's like, because then you are saying out loud, like, no, this is who I am. Like, this isn't this isn't a choice. This isn't something I can control, turn off, turn on. And I think as you respond to somebody and you say that out loud, it does help, even as challenging and hard as a situation that can be. When you hear somebody saying that, the counter of that, I do think, is important for affirming that for yourself.
Yeah. You mentioned divorce, and I've been through divorce, and I know how heartbreaking divorce is. And for me, I've always, even today, 10 years after the fact, I consider it a personal failure, and it's been one of those things that you struggle with. My question to you is, you've been out for 3 years. How was that journey for you and for your ex-wife, coming out, recognizing who you were? Was the divorce a result of this self-discovery, or was it unconnected? Or
Yeah, no, I think it was pretty strongly related to that.
Okay.
Yeah. Mm-hmm.
Okay. And your daughter, how was, you said daughter, right?
Son. Yeah.
Son. How did your son, how does he process it? Or does he not? Is he too young to process it?
Yeah, well, I mean, it's been, I think, something that, of course, we've all been like working together, for his entire life. He was 2 at the time. And I think for me personally, and in terms of how he sees me, and certainly sees me as a woman, and of course his parent, and that's always been the normal for him. And there was that moment back when he was 2, and I came out and said, like, hey, this is me now, and so I was pretty fortunate that at that time, that was really, of course, where he was starting to form a lot of his memories. And so he's always known me that way, like, as far as he can remember back, it's always been me. Which is interesting. I think about that a lot, because of course there's many people who are trans, who are gender expansive, who come out to their kids when they're older, and that can be really challenging, for sure. But for him, this has always been the normal for him. So, yeah.
Are you mom or dad?
I go by DD is what I go
DD.
by. So yeah, so DD is what he calls me.
Very, very cool. The reason I asked is I get different answers to this question depending on, as you put it, the child's age. So I didn't know. So you're DD. That's awesome. Yeah. I'm going to ask a last question, because you mentioned this to me before we got on, which is, you've had the opportunity to, you're in a new relationship. I believe you described it as relatively new. One of the goals of this podcast is to not be alone, to know that there is a life. Could you talk a little bit about finding your partner? What was that like? How did you struggle with self-acceptance? I believe you said that your partner is a female. So how does she react, respond, and how? Tell me more about that story.
Well, I mean, I think I'll speak to just the world of relationships before and after, right?
There you go.
And I think, after, well, of course, coming out and acknowledging this to myself, and really just living my truth, and starting to date, like, it was really refreshing, of course, to be dating and being who I know I am, right? And somebody dating me and being interested in me or loving me for me, and really in my truest form. And that was, of course, something that I hadn't necessarily experienced in my life. And so I'll just say that alone was extremely powerful. It felt really good. And, but it's like you deal with all the same stuff that everybody else deals with dating, right? You're trying to find somebody that, of course, aligns with you in certain ways, and different, of course, perspectives of dating and relationships in general. But I will say, like, the thing that was most striking to me, as far as being in a relationship with somebody, was just that, and of course changed the way I think about dating a lot, and like who I'm dating, and really wanting to make sure that, of course, I'm with somebody who is fully supportive of me, loves me for who I am. And I'll say that's a pretty awesome thing. I think that's what we all want, right? So
I think it's kind of the perfect way to end the podcast and end the interview, because what you're describing is you get to feel like a lesbian, which is where we started from. So that's kind of awesome. Jerrica, this was incredible. This was amazing. Thank you so much. Now, before we go, this was, just to be clear, I'm not getting paid by Plume at all, so I can say this. Could you tell people where they can find out more about your story, find out more about Plume, and find out more about just how they can reach you?
Sure. One place you can go is our website. It's getplume.co, so getplume.co. You can also find us on social media. Instagram in particular is where we put a lot of posts and share content. Same handle, getplume, at getplume on Instagram. Those are probably the two easiest places. From there, you can find a lot of other things for sure. But as I mentioned, we have a blog where we have a lot of content, and check it out. And
any parting words?
Oh, parting words. I'll just say, there's always this quote by Nina Simone that comes to mind, and where she once said, "Freedom is no fear." And I'll say, don't be afraid to be yourself. And I'll fully acknowledge that can be really hard sometimes, right? There's a lot of circumstances which can feel like they prevent us from doing that. And it might be situation to situation, right, where it could change. But really wish, hope that everybody can find that space where they can be themselves without fear, be able to live authentically. And if you're having questions about that, talk to somebody who maybe has been through it themselves. Just know that you're beautiful, you're valid, and you matter. And that's the most important part.
Awesome. Thank you, Jerrica.
You're welcome. Thanks for having me.